So we have two books written for the public that clinicians might be interested in sharing with their patients. The first book I'll mention is this one here, 7 Steps to Managing Your Memory, What's Normal, What's Not, and most importantly, what to do about it. And this book came out in 2017. And it is written to help the older adult who's noticed some changes in their memory figure out, are these changes normal? Are these changes not normal? And what should I do about them? When do I need to go see a neurologist or other healthcare professional to figure out if something is wrong with my memory? And I am very pleased to say that I think older adults have found this book useful, and they can usually sort out on their own whether or not they need to see the doctor. We also talk about what are all the different steps that the doctor should take. So we sort of empower patients to understand what the doctor should be doing. We talk about how things like depression and anxiety can sometimes feed into memory problems. We talk about what do all these terms mean? Like, what's Alzheimer's? What's dementia? What's mild cognitive impairment? What's subjective cognitive decline? We then talk about how different medications work, including medications that you might be prescribing for one of your patients, such as a cholinesterase inhibitor. And we then talk about all the different lifestyle changes that people can engage in. Again, Mediterranean menu of foods, aerobic exercise, sleeping well, things like that. We then go through in great detail different strategies and memory aids that individuals can use to keep their memory strong, whether their memories are changing from normal aging or because of different brain diseases. And then lastly, we talk about what are things that those individuals with mild memory problems should know now to help them plan better for the future. And then the last book I want to mention is one that just came out recently, copyright 2022. This is 6 Steps to Managing Alzheimer's Disease and Dementia, a Guide for Families. And this is a book that we wrote for families whose loved ones are in the throes of dementia. We start by explaining different types of dementias, how do they change over time, and then the heart of the book is helping our families to manage all sorts of different problems that come up with all sorts of different types of dementias. And we break them down sort of by topics. So general approaches, how do you approach memory problems in dementia, vision problems, language problems, bodily function problems, behavior problems, everything that you can think of. We then talk about how medications work. We call this section Ask About Medications. And we talk about the medications that can worsen thinking and memory, as well as the ones that can help improve thinking, memory, and behavior. We then talk about, how does the family members, how do the caregivers take care of themselves and build their care team, because no one individual can take care of someone with dementia all by themselves. We talk about how to sustain one's relationship if you're a caregiver, because although relationships have to change when your loved one has dementia, it's important to sustain them and keep them going as well. And lastly, we talk about practical things about planning the future, everything from respite care, day programs, long-term care, to very real and important things like hospice care, palliative care. What happens at the end when somebody's dying? How does the funeral work? We talk about all those different issues and more in that book.